Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Eating disorders can be profoundly harmful, affecting not only physical health but also mental well-being. As parents, your child's mental health is of utmost importance. It's crucial to understand the complexities of eating disorders in children. These conditions often manifest differently in younger individuals, making early detection challenging. Understanding the science and psychological influences involved is essential. Societal pressures, peer dynamics, and family interactions can all contribute. By fostering open communication and a supportive atmosphere at home, we create a safe space for our children to express concerns. Educating ourselves on prevalence, risk factors, and available resources empowers us to advocate for their well being. So let us commit to learning about eating disorders, enabling us to offer the necessary support and guidance for our children's recovery. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media. And to help us understand the significant topic of eating disorders in children, we have with us psychiatric expert Dr. Jateen Ukrani. Dr. Jateen Ukrani is a highly esteemed psychiatrist with a wealth of experience spanning over 13 years, coupled with an exceptional academic record. His proficiency in addressing a diverse range of psychiatric issues has established him as a reputable figure in the field, serving as the consultant psychiatrist and the founder of the Lifestyle Clinic. Dr. Jateen has demonstrated his expertise and leadership. Before taking on this position, he gained valuable expertise working in the psychiatry department of the prestigious Vimhans, Vijayawada, and IHBAS, Delhi, and later joined the juvenile de-addiction program at Deep Chand Bandhu Hospital. In addition to his clinical acumen, Dr. Ukrani is also the distinguished founding editor of freeassociation.in. So his extensive experience, combined with his empathetic approach and unwavering dedication to mental health, positions him as an invaluable asset to the field of psychiatry, significantly benefiting his patients and the wider community. So, Dr. Jateen, THIP Media welcomes you, sir.
Thank you, Soumya. Good afternoon, everyone.
Thank you so much for joining us today. And sir, we all recognize, the necessity of food. At times, I feel parents could find it challenging, to grasp that not eating right could be, a sign that their child is struggling with mental health issues. So let's just begin this conversation with the most basic question: that what are the most common types of eating disorders seen in children, and how do they manifest differently compared to adults?
So see, when it comes to eating disorders, there are generally, a few types of eating disorders that we see. Whether it is a child or whether it is an adult, they will necessarily have the almost same kind of, eating disorders. So the
Right.
most common types are, anorexia nervosa, where
Okay.
where the child is, restricting calorie intake, restricting, energy intake, and try to maintain a, low body weight. They feel they have a fear of, getting fat, and they
Okay.
tend to have body image issues also.
Right.
So anorexia nervosa is one. Then we have binge eating disorder, where, people tend to eat large quantities of food in a very short period of time. So in one
Okay.
hour, they will, eat more than that is required. Then there is bulimia nervosa also. Bulimia nervosa is,
Right.
binge eating plus, purging of food also. That first they will eat a lot, and then they will feel that, we have had a lot of food, so they will try to, vomit it out, or they will use
Okay.
laxatives, or they will use different kinds of, weight reduction pills
Right.
to, cut down on their weight. So
Okay.
when we look at anorexia nervosa, the people tend to maintain a low body weight. They have a very low
Right.
BMI. And
Right.
whereas when we look at binge eating disorder and bulimia nervosa, they have a high body weight. Okay.
Okay.
Then there are other, disorders as well, other eating disorders as well. For example, there is avoidant restrictive eating disorder, where, the child, these are more common in children, and the child will, not have a particular kind of food. He will dislike a texture of food. He will not swallow foods. He will prefer, liquid diet, something like that. Okay.
Okay.
They will be averse to a specific kind of food, which probably he was
Okay.
liking earlier, but with time he or she will, stop taking that food. Okay. Then there is pica. Pica is, having a non-nutritional substances, like, non-nutritional diet, like, eating sand, eating
Oh,
chalk, eating cement. So that also comes under eating disorder. So the last two types are more common in, children. And
okay.
when it comes to anorexia nervosa, bulimia, and binge eating, they are more common in adolescent age groups. The age of
Okay.
onset is around 14 years.
Okay. Right, sir. So would you say that children or teenagers, they are at a higher risk of developing eating disorders?
See, I'll tell you, eating comes naturally to us. Eating is a
Yes.
basic instinct. Going
Right.
for food is something that is inherently programmed into us when we are born. Okay.
Right.
But it is the cultural environment, how the child is brought up, what he is being taught, what are the expectations of the parents, or how he has been genetically programmed. Those
Right.
things can, predispose a child to eating disorders, and they generally present early. Okay.
Okay.
As I said, the mean age of onset of, eating disorders is around 14 years of age. So
Right.
around that time, most children will present with, some eating difficulty. And
Right.
nowadays, what we are seeing is, a lot of parents, they give phones and all these screens, these iPads and, laptops very early to children. And many times we see that these children are, watching a movie or watching their favorite cartoon while they are eating. Okay. So what happens is that when they are eating while watching a smartphone, they lose control. They are unable to keep a track of, how much they are eating. Okay.
Right.
So like I said, eating comes naturally to us.
Right.
So we
Absolutely.
need to help them understand that, this is healthy and this is good and this is not good. But when they are watching smartphones, today's generation, then they don't develop that, they don't know where to stop. They just continue to eat as long as they're, watching their favorite cartoon and all. So that also predisposes children to, these kind of eating disorders.
Okay. And you just mentioned about the societal and the cultural factors that could be a cause. But are there any potential underlying psychological factors that could contribute to the development, particularly in the teenagers?
So see, the number one thing is, genetics play a big role when it comes to, eating disorders. They are largely hereditary. And of course, when we look at, our culture, there is a, this thing that, being thin is healthy, or
Right.
being, masculine, in case of males, being masculine, having a, big muscles and all is healthy. Well,
Right.
actually, both these things need not be healthy in terms of, medically, they may not be healthy at all. Okay,
Okay.
being too thin or being too masculine, they might not be considered healthy at all. Okay,
Right.
you can still have, high blood sugar, you can still have, hypercholesterolemia in both these cases. Okay, so what we need to understand is that the cultural expectation is that you have to be thin, then only you are healthy. That is how the role models are set. Or you have to, if you are a male, then you have to be masculine, then only you will be considered healthy. So the child does not understand this. Child will not understand that, this is not correct. He will think that if I am thin, it is good. Okay.
Right.
And there's a lot of peer pressure also that goes, a lot of bullying also that goes in this. Sometimes the friends will say that you are very fat, and that the child will take it to his heart and will start to restrict his food intake and everything. Then there could be depression, there could be anxiety, there could be some narcissistic traits, perfectionist,
Yes.
personality traits. These people also
Yes.
tend to suffer from, eating disorders.
Okay. And so let's just help parents and educators now in identifying early warning signs of these eating disorders.
So, see, when it comes to identifying early warning signs, so what parents need to understand is that the child may not tell that he is having this problem. Okay.
Okay.
And you might notice very subtle signs, very small signs, like, the child will start to complain of stomach pains, or he will, rush to the bathroom after having foods, or after
Okay.
having his lunch, dinner, he will, repetitively go to the bathroom, try to, purge and, these things. And he or she will start wearing oversized clothes, okay,
Okay.
trying to hide how, thin or how fat
How
a
fat they
person
look.
is. Will try to hide that fact. And sometimes you might also notice that, there are pieces of food that are, thrown or, hidden somewhere in the room. Okay,
Okay.
because you might be handing over this thing, handing over food to your child, but he doesn't want to have it. He feels that he is overweight or something, so he will hide the food somewhere. He will hoard the food somewhere. Okay, so
Okay.
these are some of the early warning signs that we can see, and his or her behavior will become very erratic when it comes to food. He will become very choosy, very picky. You will feel that something wrong, and his weight will just not increase. Okay.
Okay. Right. And would you say that this is the stage when parents should seek professional help?
See, when it comes to seeking help professionally, I would say that it is very important that the sooner we understand that there is a problem, uh, the earlier we go to a professional for help. Because see, eating disorders, they have the highest mortality rate amongst
Okay.
all psychiatric disorders.
Okay.
Okay, because they can lead to electrolyte disturbances, they can lead to arrhythmias, they can lead to retarded growth. All sorts of problems can happen due to the malnutrition that the child is having. Okay, so the sooner it is, the better it will be for the child that you seek professional help. And it is very important for parents to understand that sheer willpower will not help the child. Don't think that child will overcome this and this is just a phase.
Right.
Whatever you tell, just plain simple advice, unprofessional advice by a friend or a family member will not help the child. He will not
Okay.
be able to overcome this without any professional help. So the
Okay.
sooner you understand, the better it is to take him to a psychiatrist and a psychologist.
Okay. And once the parents, they approach a psychiatrist for professional help, what are the challenges a psychiatrist would face in diagnosing eating disorders in children,
Uh,
particularly when we understand that these symptoms, they might overlap with normal developmental behaviors?
See, the number one challenge is convincing parents again. See, parents are not ready to believe that their child has a psychological problem. Okay,
Right.
so convincing parents that this is a psychological problem and the child requires treatment either with medicines or with therapy. That is the biggest challenge that we face in our day-to-day practice. Once that is overcome and the parents are on our side, parents understand that this is affecting the nutrition and his growth and his health physically, then it becomes much easier for us to deal with such clients.
Okay. And you just mentioned that eating disorders are associated with maximum number of death rates, right? So, can we just again emphasize on the potential medical complications which are associated with eating disorders?
So the medical complications can include, electrolyte disturbances, hypokalemia, hyponatremia, hypoglycemia. These can again lead to seizures also, epilepsy also if they
Okay.
are untreated. Then, malnutrition can be there. All the malnourishment diseases, protein energy malnutrition, like, kwashiorkor, marasmus, some osteoporosis, osteomalacia can be there. Then there could be irregular heartbeats, arrhythmias. Okay, the child can suddenly collapse, the child can suddenly faint because his heart is not beating properly. And there could be retarded growth, stunted growth. His brain may not grow properly. The brain may not develop or mature properly because the nutrition is not good. The child can have anemias, iron deficiency anemia, megaloblastic anemias, and what. So the list is very long and it is very important. See, food is a very important aspect of our life. We don't eat,
Yes.
then we will not be able to study, we will not be able to function on a daily basis. So if the
Right.
nutrition is not proper, then the physical health will suffer a lot. And
Right.
that's why I wanted to, emphasize this, that eating disorders have the highest mortality. Okay, see, depression and all, they can cause suicides and all, but when it comes to eating disorders, they have a much higher mortality rate,
Yes.
than compared to depression or any other psychiatric disorder out there. It's not
Okay.
just suicides that we are looking at, we are looking at actual physical health problems that can, give rise to, mortality in these cases.
Okay. And what are some evidence-based treatment approaches that you would employ for treating eating disorders in children?
So see, we have non-pharmacological approaches where we do CBT for children. We call cognitive behavior therapy. Then there are some group therapies where a child will be sat and the parents will be sat with other families, other children who have eating disorders, and who have overcome the eating disorder. So their experiences, their learnings will be shared with with the current client. And then there are some antidepressant, anti-anxiety medications which can be, given to children, like,
Okay.
SSRIs, fluoxetine, sertraline, depending on the condition. And
Right.
they will also help. And then we have to also emphasize that nutrition is very important. Okay.
Right.
So we have to ensure that the child is getting proper nutrition with the help of supplements.
Okay. And can family involvement enhance the effectiveness of the treatment you just helped us understand?
Family involvement is very important. If a family is understanding the situation, if the parents are understanding that this is a psychological problem, and they are doing as the psychiatrist and the psychologist are advising, then definitely the improvement will be there and the improvement will be much quicker.
Right. So I'm just going to summarize the session for all the parents out there. Could you please provide with a comprehensive checklist of actions so that parents can shield their kids against this very basic yet I would say very this particular condition lacks understanding and it's still underrated. So just help us out with that.
So see, as I said, it is very important that to understand that eating disorders are not just a mild psychiatric condition. They can be potentially life-threatening. They are very severe, psychiatric conditions. They are very common in children. They start around 14, 15 years of age, probably a bit before that. If your child is showing any warning signs, like he's eating non-nutritive substances, or he or she is wearing oversized clothes, and he's hiding food stuff behind somewhere in his room where you are not able to see, and he or she is rushing to the bathroom after eating food, or he's constantly worried about how he looks and how others are perceiving him, or he's trying to reduce his weight, over exercising, overdoing things, then you
Yes.
have to seek professional help. The sooner you go to a professional, the better it is for child.
So I think we appreciate your presence today with us, sir. And I'm hoping that the insightful information shared will be valuable to many families out there. So thank you so much for joining us today.
It was nice talking to you, Dr. Sonia. Thank you, everyone.
Thank you. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.